Hey Transformers, this is Reggie from Restore Plus Physical Therapy. Over the past several weeks, I started noticing more and more people complain of back pains. And this is not just a coincidence. And I think it's because we've been staying at home more, we've been staying at home over the past several weeks. People have not been exercising as much. People have been sitting in the couch quite a bit more, and even if they're working from home, usually they're sitting down. And what that does is it gets your body, your muscles here around the hip area, it gets the muscles stiffer, right? So are you experiencing back pain, or have you been waking up in the morning feeling stiff, or have you experienced like when you're gonna put your pants on and you feel like you can't get your leg up, or you're losing your balance and it's hard for you to even put your pants on, which before it wasn't? If you're experiencing those, then I want you to watch this video very carefully, because I'm gonna show you a way on how we can get your body loosened up in a short period of time. So this will be only a couple minutes. It's not going to take you days. Okay, so now I want to explain to you why people are having those difficulty, why people are having the pain, having those difficulty getting up in the morning because they're stiff. It's because when you're not moving too much, when you're sitting down, especially a lot, some of the muscles that get tight are our hamstrings area, the hamstrings, and the hip flexors. And when they get tight, you will be more prone to having back issues, hip issues, knee issues, or even ankle issues. To give you an idea, this is what happens. When your hamstrings are tight, it's going to pull on your lower back here, and it's going to make it go this way, because this is tight and it's pulling. When you do this for a long period of time, you're going to have back issues. All right? Now, when your hip flexors are tight, what happens is it's going to be pulling this, and this is what happens. You're going to be sticking the butt out, and when this happens, you can try that yourself. Try to stick your butt out quite exaggerate it. You're going to notice that there's some movement on your thigh, on your femur. So what happens is when you tilt your pelvis this way, your legs go in, your knees go in, right? And then when they go in, you're going to have problem on the inner part of the knee. You're going to be more prone to having knee issues, arthritis, degeneration there. And then what happens is your lower leg will have to compensate, so you're going to regain the balance. It will move out. It will angle out that way. Then you're going to have some ankle issues and foot issues. As you see, they are all connected. So the key there is to stretch these muscles, the hamstrings and hip flexors. And we do that quite a bit for patients with knee issues and back issues, and especially hip issues. All right. And I'm going to show you a quick way on how to do that. And it only takes minutes, not hours, not days. And you're going to get the result very quickly. It uses the principle of reciprocal inhibition, meaning when one muscle contracts, the other muscle opposite it tends to relax. And you'll see how that goes into play later. All right, but before we get into that, let's do a quick test. I want you to try and reach down and see how far down you can go. I don't want you to round your back too much, especially if you have back issues. So keep your back relatively straight and try to keep your knee straight and try to go down as much as you can. Take note of that distance. Take note of how low you can go, because later on we're going to do a test again. Then you're going to compare. All right. So now the stretch that I want you to do, you can do it on a mat on the floor like this. So I want you to, let me move this here, go down the mat, and so go into this position. Put one leg out if we're stretching this leg, and just bring this leg in. So when you bring this in, I want you to stretch this out, and you're gonna start feeling some stretch back of thigh here on the hamstring area. All right. Now, from this position, I want you to tighten this muscle, so meaning push your knee down. You can actually put like a towel roll underneath your knee so you'll be able to push down on it. So I want you to do this. So tighten this muscle, hold it there for a minute. You can go up to progress up to 5 minutes on each leg. All right, so start with the minute, try that. And for some of you who won't be able to assume this position, you can actually put your hand kind of behind you to prop yourself up, because some of you may actually be starting like this. So prop yourself up. You can bring your chest out and up. So you want to go up more. And you're going to see when you do this and you press down here, you're going to feel even more stretch on your hamstrings. And aside from that, you can actually just move your leg out more, and you're going to feel more stretch on your inner thigh, in your adductor area. All right, so I want you to do that on one leg. Let's start with just hold it for a minute. Tighten, make sure you tighten this muscle. You're feeling the stretch on the hamstrings and even in the adductor area. And what this does is it helps stretch this leg out. And it also, so I want you to be don't let this knee come up. I want you to be pushing this knee down. So it's actually stretching the hip flexor in this side. So you're stretching both sides at the same time, right? So when you're pushing down, the muscle back here is pushing it down, so this is relaxing. Same thing with this one. This is contracting, it's relaxing the other side and stretching it. Okay, so when you do this, after a minute, you can switch. You do this leg down, this leg out, tighten your quads. As you can see, I'm not the most flexible person, so I'm encountering some difficulty doing this stretch too. A lot of you will, some of you may be even more difficult. All right, so you do this, tighten this muscle, push this knee down, stretch the hip flexor here, stretch the hamstrings here, and when you move it out, stretch the adductors here. You can go like hand behind you, just bring your chest out, go taller, all right? And you get more stretch, and then when it gets easier, you come forward, you'll feel the stretch even more. Okay, so now, if that is easy for you, what I would recommend is both going out. But this one is better if you're actually gonna be facing, let's say, the wall, or if you have a partner. So if, let's say, you're facing the wall, let me see if I can move the camera to the side and have you. So when you move the camera a little bit, so that way you'll be able to see. I think this will be a better angle. All right, there you go. So going like this, just going up against the wall. All right, and then chest out, just bring yourself, tighten your quads, push your knees down. If you need to use towels, you can do that also. You can do this start with a minute, going to 5 minutes. And this one, you can actually do it with a partner. So you can actually be doing it at the same time. You can be doing this, and your partner's feet will be will be connected or in contact with your feet, and both of you will be pushing out. And what you can do is you can actually hold each other's hand and keep your back straight. Just you can pull the other person in, will give them more stretch, and then the other person can pull you, give you more stretch. Make sure you tighten the quads also. So when you're doing that, you can hold that for 1 minute to 5 minutes. When you're doing it with your partner, you can just change stories, look at each other in the eye, just spend some bonding time, and at the same time getting the stretch done. All right, so after that, now I want you to do the test afterwards and see how you feel. All right. So from compared to earlier, so I want you to do the test again. Just try and see if you can bend down further. I actually didn't even do it the full 1 minute I was explaining. And when you go down, for me, I see quite a significant difference already. All right? So I want you to try that and see what change you notice. See what difference it makes. See how it affects your hips, your back, your thighs, and let me know. I would love to hear in the comments below what impact this has on you, how this makes you feel. All right? So I want you to get started with that and let me know you have any questions, shoot them in the comments below. All right? So till next time, stay safe, stay healthy. Bye.